based on our experience on implementing risk reduction activities in Nepal, the risk scenarios are very important because of the two reasons. Number one is it helps create awareness also and motivate people. Number one. Second is it also helps define the extent of the problem and then our, the planning of our risk reduction and preparedness activities. In addition to what Emily said earlier, I just added this slide over here in the classroom itself, that once we have all these numbers in place, sometimes it's difficult for people to understand. Even the 7 people in 100 years, people may think that that's nothing. We may not need to do anything because 7%, and they imagine it's only after 100 years. They don't consider it's next year or this year. So, the 100 years, sometimes the probability are so difficult. To be honest, even for the policymakers and decision makers to understand. So in our experience, what we do with all these numbers is we translate and interpret that to like this as an example. The Kathmandu Valley, we did the risk calculations for water supply system. The number came as 2,000 breaks to the water supply pipeline of more than 4-inch diameter, something like that. Nobody understands what does 2,000 breaks to the pipeline system of more than 4-inch diameter, and what does that mean? But when we translated that information to this type of the impact, and then said to the everybody that we are not getting water for a week, for 2 months, 3 months, so we have 6 months scenarios or 1 year scenarios, depending on the capacity of the water supply corporation to repair all those. And then when people know that if there is an earthquake, bigger one, and there is a damage, and we are not getting water for 6 months is very clear for everybody, and then that helps design the risk reduction programs. NSET work is, I'm sure that you know NSET. If not, you may explore through our website. We are in non-for-profit organizations. They're working in this field for the last 30 years. The earthquake risk reduction is our specialty, but overall we work for the disaster risk reduction management. There are two streams of the work: linking the policy to the practice and linking the research to the practice. We are more of the facilitating, linking organizations than ourselves as a policy creator, because it's the government's job. And we are not the academic institutions, so it's not our job also to do the core research, but we facilitate that. Whatever is the research outcome to the implementation, whatever is the need to demand for the academic institutions, and vice versa. Our strategy for earthquake risk reduction, that's the topic given to me, is there are 3 approaches. Stop increasing risk. So all the constructions, new buildings or infrastructures, has to be resilient. Reduce existing risk, so means retrofit the existing buildings and infrastructures, and then be prepared for consequences. In that model, and I read the whatever your takeaway message number 2 for risk reduction, reducing either the hazard, vulnerability, exposures. In our case, in earthquake, we cannot reduce the hazard because that's beyond our control. It's not possible even to reduce the exposure because we have to stay here. We cannot go to somewhere with our earthquake risk in the globe. So we have to stay here. Means there's only one way is the reduce the vulnerabilities. That's what we have to do. I'm talking these two, the previous two, but leaving that be prepared for now, considering the time frame. So as a case study, I'll present 2 case studies. One is to stop increasing risk is building code implementation. Because for earthquake, from where the risk comes from, even if we calculate hundreds of times all these, tentatively all the risk comes from the buildings and infrastructures and their vulnerability in our case. Because hazard we cannot do anything, exposure we cannot do also. So that's why it comes from vulnerability. Our previous calculation is a part of the global research, 2003, global, the Earthquake Safety Initiative project. Kathmandu was one of the, the city out of 18 different cities globally. And this was the finding that should there be an earthquake, larger one, most of the risk, about 80% plus, comes from the damage to the buildings and infrastructures. But the remaining comes from the lack of the preparedness, so that the immediate search and rescue or medical response, little bit from the fire or the landslides as well. And this is the data from the 2015. Sorry, it's 2016. That's a typo. So 2015 earthquake is the about 9,000 people killed. The less than 100 from the landslides or other debris in Langtang, in Russia and other places. So most of other people killed by the damage of buildings. So from earthquake, actually, in terms of the casualty, all the risk comes from the damage to buildings and infrastructures. So even in that calculation over there, why we need rescue is because people are trapped in the damaged buildings. Why we need medical support is because they are injured. So actually, that was also correct, So in this case, we could not separate that. That's all. So because we didn't have that level of the depth of the data, that how many people were actually killed immediately within a minute, and then how many others, killed because of the lack of the rescue and the medical support. The building code was formulated in Nepal in 1994. NSET was in this field working, but even up to 2011, despite several tries and support to the city, this was the situation. All these cities are the urban municipalities at that time in Nepal. You can see only 2 cities implementing code. Other 14 in the process, but still not implemented, and then others many no start even implementation of the code. The code was formulated in 1994, means 6 plus 11, 17 years. And after 17 years, this was the situation. So it was an alarming, and we did a quite extensive research that why it's not happening. So we went to most of those cities, talked to people, different groups, technical, policy, communities, and then tried to understand people why they are not doing. Is it because there is lack of information? Is it because they don't want to do it? And then what's the level of the actual implementation? And you see here, awareness, there is more than half. People know more than half of the information they need to know. So there was information. Even much larger that they want to do it also. But in terms of the implementation, almost zero in most of those cities. So why? They want to do, they have the information, they are not doing. And we analyzed carefully, and we found that the half information was a big problem, because in that half information what they learned was there is a problem, but what they could not get was they can do it, they can actually reduce it with the economy they have. So that part was missing, number one. Second is, that's why their attitude is, there's a problem, we wanted to do, but we cannot do. That's why that attitude of, even they want to do, but they are not doing. So their practice was so low. And then we formulated a program to tackle to these 3. So as a base is still the awareness, the foundation. That awareness is to change that mindset of not only to understand that there is a problem, but to understand that it's possible to do. That creates a demand. The second is we have the sufficient capacity at the local level, at the municipality, at the private consulting firms, at the academic institutions locally to meet that demand. And third is to have the right institutional mechanism and system. And then different stakeholders, different activities planned accordingly. And then based on our previous experience also, what we learned was, in most of the cases, in many times, people think that, okay, if we enforce, they will do it. But only enforcement is the part of the system. If there is no acceptance, and if there is no capacity, that doesn't work. Even if we work only raising a lot of awareness, but it's not back up with the sufficient capacity and the system, that can go up to some level, but cannot reach higher again because of a lack. So combination of these three and working together in all these three components are very important, and we did several awareness raising, hoarding boards, shake table demonstrations, pamphlet, posters, radio program, television programs, so many things. Intention is only one, to let them understand there is a problem and also let them understand that the solutions is doable. The second is capacity strengthening, and sometimes we miss it also, and we focus only for the capacity strengthening of the engineers or the technical people. But in our case, it's everybody. So starting from the decision makers, the mayors, to the engineers, to social mobilizers, to the construction technicians, to masons, to homeowners, to government officers, everybody, trainings. And trainings, we also learned that working together is the best training. In this classroom, even if I repeat it 10 times, it's difficult. But the way that Emily showed you to calculate is the best way actually to do it, and working together in the real field. This is a hypothetical scenario. So, that's the best way for the training. And initialization is having building permit system in place. What's the application process, approval process, operational inspection system. So it's not only theoretical, but the practical institution and the people, provision of the budget and continuity, all this comes for the system part. So we worked on that. Research backup always help to build the confidence, especially for engineers because they don't believe to me. So we have to show that, okay, if you don't implement the code, this is the building, I don't know how to provide it, but yeah. So it's, there are so many scenarios again. So the video is slowed so that you can see the damage patterns and others. So it's, the 0.1 GR Takaturi earthquake, 2.5 story building, and then, with the gable wall, typical Nepalese brick buildings, no code implementation, and it failed. So, yeah. The second one, code implementation based on our code, mandatory rules of thumb, the same building, and that is 0.5, means 5 times more in terms of the acceleration. It's shaking quite well, but you can see that the blacks are the cracks, so still there is significant cracks propagation both at the bottom of the building or near to the roof layer also. But nothing happened, means with just 5% extra cost, there's so much of the safety. So that's what, we wanted to show. There is an average, let's say another building, it's a relatively nice building, cement mortar, that previous one is the mud mortar. The cement mortar buildings, 2-story, no gable wall, but you can see at 0.35 G. Earlier it was 0.1 G. It is in this cement building, 0.35 G, and you can see still damage. The same building, the code implementation 1G, so about 3 times more acceleration, and 1G is really, really big. You may explore later. So, and all these informations help build the confidence and also convince and motivate. And then that's how, using all those informations, we work in so many cities in Nepal, and then you can see the different colors are the level of the input, given in comparison to the population over there. And this is the result. So the first one is the permit system in the municipality. So it's a drawings inspection and how much are the compliance to the code. 2012, 85% non-compliance. 2018, 1% non-compliance, 14% near to compliance. And then construction, because construction is more difficult, the permit is engineers make, so it's relatively easy. But even in the construction, you can see in 2012, 81%, and then 18, 3% non-compliance. So huge changes, and it's not one city, it's 30 plus cities in Nepal, our Nepalese cities, And it's all 100% of the buildings under construction at that time when we surveyed. So about 5,000 plus buildings of all the cities of the inspection time. So it's a quite big changes in the shift, and that came from that right approach that we took. And those near to compliance are actually, most of the provisions are made, but still they are quite resilient already, but not 100% meet to the criteria. If we add those, you can see here from 15% at the beginning to 19% to the 97%. That's the first one, stop increasing risk. The second one, I'll go quickly, is retrofitting, because all the buildings are already built, or many buildings are already built. Stop increasing is the best way, very cost effective, and for earthquake it's much easier than flood. There is only few provisions, you do it, they are safe. But the flood, sometimes the location wise, and every house is different for the flood risk reductions, because here and there is much different. But for earthquake, it's not so much. Our buildings, again, brick, masonry, we were not sure if we can retrofit our buildings or not. We started in 1997, choosing schools as a public facility, because we did the assessment, risk assessment. We found that 75%, more than 75% of the schools would collapse if there is about 0.4 G plus level of the shaking, which is very probable in Kathmandu. So that's the starting point, and that's why we have to do something with the schools, and that's how the retrofitting started. The initial questions were: is it technically feasible, economically affordable, people will accept it or not? Local people can do it or not. So those are some of the questions at the time. That we did in some schools, and then it was technically feasible. And then when we are doing it, some of the people asked why we are doing this, and then we started master's training, and then convincing parents, motivating students, teachers, social orientations, Ministry of Education's involvement, department's involvements, and others. And that's how our school program became wider and wider. Together, not only by NSET, but NSET started, but there are many institutions involved in Nepal. Among the developing countries globally, there is not many cases that the people retrofitted their houses or the schools before earthquake, and then earthquake tested those. So in our case, fortunately, we had more than 300 schools retrofitted, all 100% performed very well. Even in the same compound, you can see here the left photograph, the pink building, it was brick in mud building retrofitted. Near to that was the reinforced concrete building, school building, that collapsed in the same compound during the 2015 earthquake. So the benefit of retrofit, the pink was even no crack. So that's the already proven success that retrofit technically worked, and also people had a lot of confidence. They were using those retrofitted buildings because they have learned that these are meant for earthquake safety. Sometimes their houses were also resilient, but they were not confident on those. So the information, and we use different retrofitting techniques, splintered bandage, that vertical, horizontal, the concrete strips, concrete jacketing, GI wire base. When we went to the houses from the schools, the polypropylene band, reinforced concrete buildings also, jacketing, shear wall, changing even sometimes their low-story reinforced concrete with the masonry infill to as a hybrid system and retrofit those. So different methods were used. Research helped again for this also, because in terms of the retrofitting technique, this was after Gorkha earthquake. Ranjan is here. He was our program manager at the time, leading the Balyohar program. So we did some tests in China together with the many Nepalese professionals also visiting, doing full-scale cyclic test, and then understanding which retrofitting system is better, but at the same time almost full-scale, the shaking table test for the two-story stone masonry building, simple retrofitting technique. And the beauty, this is quite well published in Bulletin of Earthquake Engineering. You may download the paper there. So it went up to the 1G, the El Centro earthquake, and then nothing happened. So, stone in the mud building, 1G level of the shaking. So all these, the informations were actually for us as an implementing organization were helpful to convince engineers that, okay, this system worked. Otherwise, all of our education system, by the way, designed and supported by, the Canadian government, are depending on the, concrete and the steel structures and the main principles and philosophy on that. And we don't have relatively that level of the the research capacity and then that depth of the, the even knowledge sharing for this type of the buildings. And it's not only us in Nepal, globally. So, all these. But the more important for us is translating those research information to the policy, like this one, the left, and then to the implementation is what NSET does, and this is what our experience is. Summary: earthquake risk reduction is technically feasible, socially acceptable, economically viable, even in our context, means developing countries. Resilient new construction is of immediate need and possible to start immediately. Public buildings are the immediate targets for the retrofitting. Comprehensive approach and involvement of all stakeholders is essential because you see that circle and these three, different requirements for the even building code implementation. And linking all those researches to the practice is, it helps build the confidence. Thank you so much. Yeah, we have 7-8 minutes for the interactions.
Thanks for that presentation. Do you think that you would have seen as much compliance if the 2015 earthquake had not occurred? Like by 2018, you showed very good results. Do you think it would have looked the same if there hadn't been the earthquake in 2015?
The earthquake might have really, that's progressing quite a lot even before earthquake. And then even after earthquake, you see, when we went to Doloka with Ranjan and Bijay, people were throwing stones to the river because they knew the problem. So what earthquake showed was the problem. And that information even in 2011 was known to many of the people, right? What they didn't understood is there is possibility that they can reduce it. And the earthquake did not do anything for that. We did it. We means not only NSET, together in Nepal. So it's not that earthquake. It's it's that motivation coming from different institutions, that system, socio-technical support, awareness to the next level. Awareness that there is possibility of problem was already there, and that was demonstrated more by the earthquake. But that did not demonstrate that the good work will work much. Yeah.
Hello, sir. So we've been hearing that Nepal's western part is very vulnerable to a major earthquake in near future. So I wanted to ask, like, what is NSET or other organization or government are doing about it? Are they taking any precautionary measures or any information on this?
Yeah, thank you so much. I mean, you have to choose the right word. Vulnerability is everywhere in Nepal. It's not only in the West. The possibility of the hazard, bigger one, that the big hazard, and that's probability is slightly bigger in the West. That doesn't mean that we will not have the earthquake in the East. And then there can be the earthquake in the East first, then the West also. Okay, because I studied in Japan, he studied Keshav. The NIED has very good leaflet, even the plastic folder that shows that Tokai, Tonankai, Nankai earthquake, and that possibility was 90% over 30 years. And the Tohoku earthquake, there's only 70% chance in 50 years. But that happened first. So, nobody can tell where exact. And that's why we have to work everywhere, first of all. There has been some initiatives by the government, by institutions like us. But one thing is pretty clear, that whatever we are doing together is not sufficient. And we have to do much more. And that much more is these three things that, especially for earthquake safety. So do you have the proper level of understanding at different level? Number one, do we have the capacity locally Third is, do we have the proper institutional system and mechanism backed up by the resources, including the budget, to continue that work? So these are the indicators to measure, and then when we check those indicators, we have a lot to go. That's how I can say.
You had a slide that showed all of the different types of people that needed training. How did you create the capacity to do all of that training? Like, how many trainers did you have, and how did you create the courses so that you could reach so many people across the whole country?
Yeah, that's very important. Development process and the system. And we rely mostly with other institutions. It's not only NSET who did it. So it's, we have the, instructors across the institutions. But we, for the course itself, there is also a process to develop the course, to get the approval or accreditation from the government institutions. So most of our courses are related to buildings, is with the Department of Urban Development and Building Construction. So I saw the numbers that we train, but there is much more. Like even the earthquake reconstruction, Ranjanji, how much was the total trained people? I think we trained about 7%, and that 7% was about 14,000. So you can imagine. The 7%, you can do the math. So 7% was 14,000. So that scale was trained. But the beauty is, same curricula that we developed from NSET, approved by the government and mandated for every institution to do the same. And the instructors development process, and many of the instructors were our trained instructors. And NSET is proud of that. And this is how we did. Yeah.
How many years did that take to complete?
About 5 years after the earthquake. So it was after the earthquake calculation. But our was even that 14,000 or 20,000 before the earthquake. And that's the more important. Sometimes now we have so many institutions. We are proud of that, and we are happy to have them. But the previous work sometimes is forgotten, created that background. So in Nepal, after earthquake, we didn't have to create any new damage assessment guideline. We already had the damage assessment guideline. We had some people already trained. We had the vulnerability assessment guideline already developed, and many people were trained. We had the message training manual and others and instructors already approved, so we could go immediately. So all these preparedness and risk reduction activities before disasters are super critical to have even a right, the recovery, For example, if there was not this type of the preparedness, maybe our reconstruction would have been much, much different. So the authority in the reconstructions, we may say that, we did a very right job, very good job. We have, 80%, 90% compliance and others. But without that background work beforehand, I am sure that would not have been possible.
Thank you.
That your first focus is on retrofitting of the public infrastructures, but what about the private infrastructures? Because even in my experience that I can see within the Kathmandu Valley, there are many people who are living in the earthquake damaged buildings. So what can be our plans and policies to tackle that?
Yeah. The retrofitting is not so easy, first of all. If it's a new construction, we could very easily convince within an hour. But retrofitting has so many things. Even not only here. It's not only because we are Nepalese. Yokohama city had the provision of 80% funding for the people who are implementing retrofit. People still did not do it, even in Japan. So it's difficult because the existing building already built and others. So there are 3 or 4 criteria that we can consider for the the individual's houses retrofit. Number 1 is definitely the cost parameter. We strongly suggest, in Canada it may have different value, and then in Italy we checked and they have different. But in our case, about 30% of the reconstruction cost justifies if it's technically feasible to have the required level of safety to retrofit. Second is the functionality. If it's an old building, and even if you suggest, people will not do it because the functionality of that building is already gone, and then even if after retrofit, it may not be useful. The second is the life period, even after currently it's functional, but how long that will be useful. So these are the three criteria to use. And then for convincing, there are many other ways. We are trying. We don't know the 100% answers for that also. But the indirect method, for example, beautification together with retrofit, because people want to paint their house anyway. So in some buildings in the West, let's say, the Gorai municipality, we work together with the municipality itself, and they are happy to fund part of the retrofitting. So they give about 100,000 subsidies to people in terms of the materials, and if there is a good technical support, people can do it. So there should be some sort of the mechanism based on our experience. But as an institution like NSET, we could not provide the services to the individual private owners, because our job is more to create the system. Because if we start doing it, how many we can? Only few, right? So our job is to help academic institutions, private sectors, even the government to have the right policies, standards in place, the right amount of the knowledge, different level, so that we can tackle that problem. Yeah, it's working.
Hello, sir. I just wanted to ask this because you are from NSET and it's mostly related to the structures. And we talked about retrofit. I believe that before we retrofit, we have to access the structure. So I wanted to ask some questions related to it. So are you guys working on structural health monitoring systems or structural health assessment? And in Nepal, do we have any coded provisions or any manuals or something regarding this sector? So I just wanted to have, is there any development on this particular
guideline? And that gives all the parameters how to do, including the qualitative as well as the quantitative. And it's the government document. It's not NSET. NSET was involved for the creation of it, but it's Department of Urban Development and Building Construction. So we have the guideline. Okay. Thank you so much.
Considering the recent events in Himalayas or even in Kathmandu, like flooding, debris flow, gulfs, and then even considering the localized landslides within Kathmandu Valley, we have noticed several landslides within Kathmandu Valley. So, do you think the provisions we have in our building codes or standards for geotechnical issue or geological issue, considering liquefactions, slope failures, so many, etc., so it's enough in our current standards for buildings?
It's not enough. There's a simple answer for that, because the number one is you have to take it carefully for the small buildings, and if the location is not in the really high flood zone or the landslide area, the other liquefactions and others are well taken care of. For the high-rise buildings, it's a serious issue. We don't have sufficient codal provisions. That doesn't mean that the designs are really bad. People might have considered other codes from other countries also, and they're professionally, structural engineers, geotechnical engineers. But in our provisions, we don't have sufficient, number one. Second is because we're advanced in earthquake, I think some degree of, the role goes to NSET also. But that same system may not work for the flood risk reduction, right? Because I mentioned earlier, earthquake is easy for us. 10 provisions, go and implement. It's quite significantly resilient building already. But for the flood, this location and the 5 meters away location is a huge difference. So we have to have very different approach for the dry flood proofing, wet flood proofing, shifting the locations, other, the whole catchment, the risk reductions program, flood mitigations itself. So it's a very comprehensive thinking and also quite complex in that sense, right? But all these requirements are not there, so that's why. Okay? Perfect. Thank you so much.